Hi, I'm Dr. Rajani. Thanks for joining me today. I'm showing some footage of Kybella on the love handles. Injection lipolysis to reduce fat in a hard to treat area. And we're going to talk about the body. A lot of people ask, can it be used on the face? Can it be used on the body? I'll show you in the injections here and you can see it being done. But also remember, Lipodissolve was something done about 2004 to 2010, 11, maybe 12. It lost a little bit of its fervor because people were using it aggressively and ulcerations were occurring. There were side effects. People were using it as a weight loss, but it's making a resurgence on the face and the body. I'm going to take you through the injections today, talk a little bit about phosphatidylcholine, deoxycholate, Kybella concoctions, and we're going to get right to this video in 3 seconds. So Raji's quick clip, remember, if you like the videos, click like, click the bell so you'll be notified when you subscribe to all the upcoming videos to keep your skin and body beautiful. And I have playlists, so if you're interested in the neck, if you want to see all the videos on dissolving in the face and how to use the product, how we use it in practice in the different areas and what it does, the side effects, the downtime, the pitfalls, you can watch that playlist. It'll just run through them for you. Today, we're talking about the body. So injection lipolysis is one option. A lot of people do freezing or cryolipolysis with something like cool sculpting or versions thereof. Some people use heat, laser type of energy to heat, or radio frequency or high frequency ultrasound to shrink fat cells. But what Kybella, which is deoxycholate, generic versions would have deoxycholate plus or minus phosphatidylcholine. Some people use phosphatidylcholine alone. Many people might add B vitamins like vitamin B, something like aminophylline, or some collagenase type of product to help reduce and shrink cellulite and fat. So there's different concoctions with vitamins and different formulas you might see. Especially overseas, you can buy them, they all come as one. You inject it, and what it does, it disrupts the cell membrane. The biphospholipid membrane of the cell, it disrupts it and destroys the cell. So it is long-term. Fat cells are meant to expand and contract. And if there's less fat cells there, in a sense, it's permanent. Could you gain it back? Yes, because the fat cell can still expand, but it's less likely to come back in that area. Very similarly to cryolipolysis or cool sculpting, only in this case, we're destroying the fat cell with the injection. So what areas on the body work with this? Well, I have experience with the arms, underneath the arms here. Certainly, we used to treat cellulite a lot, not one of my favorites. Inner thighs, you can be left with little nodules for a while. They always go away, it seems, but it's a more tender area. People do also use it on the stomach. That's a great area. Love handles. The breast area for men is treated. Back fat, bra fat's a great one. So there are areas, as long as it's anatomically safe, you'll see data on it, you'll see studies. There are some problems if you inject it wrong, if you put it too superficial, if the dose is wrong or too much is put in. But definitely the depth of injection is key because you don't want to go intradermal or you can end up with an ulceration. Very rare, but we did see more of it when Lipodissolve was used for weight loss. People were promising bulk reduction. It's not really meant for that. Kybella itself was studied for under the chin. It was standardized with a grid pattern. It was a large study, and we looked at submental fat reduction with before and after pictures by evaluator and the patient. And that was an area that was chosen because it was on the face. Companies are already doing fillers and neuromodulators, and it could be standardized pretty well. It's also a small area. If you get to the body, you're going to use a lot more. And if you're using Kybella, it can get expensive, but it does work well. And like the submentum, you can do ongoing treatments. Several sessions is common to get the best result. So let's watch the injections here. If you see, it's a series of injections along, in this case, we're treating the love handle, as they call it, or the lateral flanks, and injecting it in the correct dose. You can, again, use a combination, and you're tracking along at a certain distance between them based on the dose that you're using, and of course the depth and the amount of fat. As you see, the preparations are different. Deoxycholate, phosphatidylcholine, plus the vitamins or trace minerals. It's an art. Everyone's going to have their concoction. And I'm talking globally now, because in the United States, FDA approved is Kybella. It's the only one FDA approved. So it's the most common one that people are going to use and feel comfortable using. The results, you're going to get swelling. And the swelling can last for several days to weeks, even months at times. That's more rare, but final results often do take some time to see, and I say in general 6 months. It's not a substitute for diet, but if you think love handles, back fat, bra fat, very hard to treat no matter how much you diet. So a lot of people do come in for this treatment. I have a lot of videos of dissolving the face, other areas of the body. We have sculptor butt lifts if you're into body, cryolipolysis. Join me and join the playlist. Go to the playlist so you can watch whole playlists on these videos. Tell me, what do you want to see next? What's your experience with using Kybella or different treatments of injection lipolysis on the body? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.